Hi, I'm Dr. Elizabeth Coyne and I've got with me Jodie, and we're going to just go over the A3 assessment item for 2806 NRS. Now this assessment item is building on what you did in A2. It is 1,500 words worth 45%, marked out of 50, and it's due in week 11. So lots of time to get yourself organised and have a read through this once you've finished A2. So basically the aim of this assignment is to really look at the way you are looking and reading research. So it's to build your skills from A2, which was that annotated bibliography, the summary and the little bit of critique of the articles, to really then sort of look at one particular article and use your ability that you've learnt over this course to evaluate the quality and relevance of this research to your nursing practice. So specifically, the task description asks you to identify and explain different elements of the research process that are evident in the article. So as you're reading through it, think back to your tutorials and what we did. Then you're to critically evaluate these research elements using the appraisal guide with reference to recent and relevant scholarly literature. So you will need to then find other literature to support, and then discuss the significance and implications of this research for contemporary nursing practice and standards of care. So Jodie, why is this important for nurses to develop this as a skill?
When we're looking at implementing clinical practice, it's important that we come from an evidence background. We're able to look at articles and critique them to determine if they're appropriate for the interventions and the care that we're delivering to patients. And it's about understanding where to look in the articles and how they can apply for you.
So this is the article that you're actually doing your critical evaluation of. It's a very clinically focused article and very current in our sort of clinical background where IVs are used constantly.
So Elizabeth, with regard to the template that we're using to draw out the information from the article, you'll note that the template on the screen is being used from weeks 3, 4 and 5 tutorials when we looked at the qualitative, quantitative and mixed methods. So you did develop some preliminary skills during tutorial when you looked at those articles, and we filled out this template whilst we worked together in our groups. So a great way to start is to grab the article that we're looking at for A3 and start populating this template. So we want to draw the information, that critical information from the article, and build this template. We did the PICO, okay, so we worked through that in tutorial, looking at the problem, looking at the intervention or the comparison, and what were the primary or secondary outcomes. That is around 100 words. So what you will do is you'll populate the template with information from the article, and then you will write that up in an essay format. Moving on from this section.
And one of the things to remember is that you can start working through this, you know, sort of go back to tutorial information where we did this as a group and sort of remind yourself of what we were actually looking for.
And that's a really good point, Elizabeth, because we did complete these in tutorial. So you should be able to draw out that information based on those articles that we completed.
So the next section looks at the journal, quality, and also the authors. Now we've all looked over this as well. And so just remember to sort of have a look at that, remembering not too many words in this particular section because this is actually included in the section above. So now we're getting into the research design, 250 words. Again, not a lot of information, not a lot of words. So do your summary in the template and then move it across into an essay format.
And you can see from the information provided on the A3 assessment tab on the L&G course site, we've included some key questions that you should be able to address when looking at each section. So the research design part is 250 words, and you're answering questions including, is it qualitative, is it quantitative? You can review topic 2.3, okay, that will help you answer this section. What were the research questions in the study? and why indeed was that study needed.
Yeah.
State the reason. We want to see that information.
Yeah.
Are there hypotheses stated in the study? And you can describe them as well, and describe how the interventions were carried out.
And remember, it's a critical review as well. So sometimes you might find that, you know, there's an issue or something that they haven't followed the sort of the design framework that would be expected for that methodology. And so you can actually comment on that with that critical evaluation. Just remembering that you do need references throughout this. There's expected to have 10 references all up. And so make sure as you're reading through it that you're thinking about what other references can I use to support what I'm writing in these particular aspects as I'm going through this process of critical evaluation.
So could we just go back up, sorry? So then we're actually looking at the sample, 150 words, and we know from those articles in tutorial, you know, that we did an article around the paediatric population. We also did an article around the dementia population. So you should be able to draw out the sample information and identify and describe the setting. So is it hospital, community, at home? And you can see were the participants accessed and how were they recruited. So we want to outline that process as well. And also around ethical approval. So we do want to see in a succinct 150 words, and that's often the hard part, how to define the sample.
Yeah. And then data collection and data analysis. Again, following the examples that we've put there, which we've done in all of the times in tutorials, that you work yourself through it and really sort of begin to understand what makes up the article, and going back to the course content if there's any bits that you need to actually have a bit more depth to understand what's happening in this article.
And you'll find the headings should correlate to headings that you see actually in the journal articles themselves if you're having trouble finding the information.
And so with the results, it's sort of that summarising the researcher's report, and this is where you include bits about where the research questions answered and why, and justify your answer with external research references, and suggestions for further research. And that's found in the recommendations section. It also might be found in the front in the highlights and what is the so what part of this particular journal article. So, you know, just remember where to look, pick them up, identify the importance of them, and think about how you may justify that with other external references.
And really important is the relevance to clinical practice. This is 250 words, and what we want to see in here is your critical evaluation of this article and how it relates with recent and scholarly literature to clinical practice. Does it look at evidence-based principles in practice? And there's 3 key arms that we're really wanting you to expose here. Patient values, is it useful for the patient and do they accept it? Were there any negative outcomes, and that's really important, or side effects, adverse events for the patient? Then looking at clinical expertise. Was this always useful? Or is there any context changes in response to the evidence that we need to make? And then also look at the available evidence and what other evidence exists to support this. Sometimes in this section, as throughout that main document, you may find some really good references within the references, the reference list of the article published.
Yeah. And so this last slide just really looks at that sort of how the overall essay should appear. And so remember, it's suggested word count for those sections. So you might have a little bit more in some, but you've got an overall word count to keep to. The suggested word count enables you to meet that word count. And so remembering to go through the different aspects using those headings so as you critically evaluate and justify this research article.
And as we've mentioned in Shoots, the template is just that. It is your resource tool. It is what you're going to complete to get your thoughts together to answer those questions in the template format. Then when you come to structuring your essay, you can use these headings. And within those headings, you then draw out the information from your template to answer the questions.
And so hopefully this has been useful just to break down A3 and help you understand what each part means, but also remind you of the fact that in tutorials for 4 weeks you went through this template and you're able to sort of talk about it in your teams. And so, you know, go back over what work you did and the notes you took, and start to slowly work on this one. So by week 10 and by week 11, you're completely done and ready to submit. Thank you. Oh.
I was just going to add one thing, sorry. We will also be doing a collaborate session in week 9 to answer any questions that you have around this essay. Good luck, everyone.
Okay, thank you.